Hi viewers, welcome once again to Health in the Spotlight. My name is Rina, your lovely host. The job of a nurse is to care for their patients till they get well or they pass on. Some of these nurses are going extra miles to put more than smiles on the faces of their patients. I have with me here today an amazing woman, Wendy Ofori. She's a staff nurse from Okai Chrome Health Center in the Setri East District. She's been a nurse for the past 10 years, and her experiences has pushed her to start a foundation to help her patients. Stay tuned, viewers. We'll be right back with her story. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Welcome back, viewers. And today, my t-shirt is from Rina's Couture. I customize my own quotes on these t-shirts. So please go to Rina's Couture for your lovely clothing. Hi, Wendy. How are you? How are you feeling?
I'm good. I'm very fine. How are you?
I'm good, thank you. Can you tell us a little bit about yourself?
Well, as you said already, my name is Wendy. Grew up mostly in Kumasi and in Sunyani, a nurse by profession, and I also run an NGO, as you know.
Wow.
Sorry, that's it. Yeah.
So, Wendy, can you tell us a little bit about your duty, your job description as a nurse?
Well, we have category of nurses, as you know,
Okay.
but I happen to find myself in a health center. So let's say I'm not strictly going by the staff nurse category. We do a little bit of each, from OPD to family planning to maternity, and a little bit of each.
Wow.
Actually, yeah.
So, as a staff nurse in a health center, you basically run the whole unit. Is that what you're saying?
We work together.
Okay.
Yes, basically. Mostly we run the OPD, and then we do the curative part.
Okay.
But we also collaborate a lot with the preventive part because we are just a small facility. So we work together. So you can't really specify what a staff nurse does in a health center. Yeah.
Oh, okay. All right. Cool. So, growing up, can you say you had certain experiences in life that actually influenced you to be a nurse?
Yeah, sure. Being a nurse, I think I wanted to be a nurse somewhere when I was in SHS. I was sick, very sick actually, and then my mother rushed me to the then Sunyani Municipal Hospital. Yeah, it used to be the regional hospital, and then I remember the care that I got, the attention, how swiftly they worked, and then within some few minutes I was okay.
Wow.
So in my head I was like, okay, so when I grow up, I want to be able to deliver this service to someone when they are in distress. Yeah. So actually that's where I started getting the idea of wanting to be a nurse.
Oh, okay, all right. You made mention that you have a foundation. I mean, it's not common actually to have nurses starting foundations. So, what made you start a foundation as a nurse?
So I would say in quotes, Facebook made me start a foundation.
Oh, wow.
I
Thanks
mean,
to Facebook.
when I started, it was just an individual nurse who was trying to help her patients.
Okay.
We put the stories up there. I mean, we get help for people that need it. Children, actually, just children. So when we had been doing this over and over again, back and forth, and then a lot of people on Facebook will go like, why don't you start a foundation rather? Why don't you make this thing legal? Why don't you make it bigger so that you can extend the support to a lot more children all over the country? So we considered it and then decided to start a foundation. But we had already been operating,
Oh, okay.
like helping people individually from our own coffers and stuff, and then help we get from people. But right now we have a registered NGO.
Oh, okay.
Yeah.
Maybe you should tell viewers a little bit about your foundation and just to give them a heads up on what we're talking about.
So what we do is, you see, I work in a community where I come in contact with a lot of needy people. So it started from when maybe a child needs a medication, the mother cannot afford it. Maybe a child needs surgery, the mother cannot afford it. And then sometimes we pay, sometimes I post it on Facebook, and then people will come in and support. Then it extended to every part of the country, actually, where we have people, my colleagues actually, asking me for help from the north, from
Wow.
central region, from Accra, from the Bunahafu region, and then that's how it all spread. Like,
Wait a minute. Your colleagues asking for help for clients or
yeah,
asking
yeah,
for
yeah,
help
yeah.
for them? Okay.
No,
Uh-huh.
definitely not for themselves, for clients
Okay.
actually.
When you look back at the number of people that you've helped, first of all, how many people have your foundation been able to help?
It's always difficult when I get that question. I'm like, can I even put a figure to it? Because I could say over 100. I have names though, but there are some of them that is just a call that says, "Oh, could you please assist us get this drug for a patient?" I'm like, "Okay, we would assist you." And then some of them I don't really put it down because I feel like you're just lending a hand and stuff like that. So
Yeah.
probably over 100 children. Yeah,
I
yeah.
should clap for you. You
Thank
actually
you.
deserve a medal,
Thank you.
honestly. So when you look back at all this that you've been able to achieve, because you started the foundation alone.
No, not alone.
You didn't
I
start it
have
alone.
partners.
You have
Yeah,
partners, okay.
yeah.
But when you look back at what you've been able to achieve so far with the foundation, how does it make you feel? Like,
Well, let's say, I mean, I'm a mother. Sometimes when I see these children, you would imagine your kids in that same condition that the child is in. So the fact that you've been able to help a child, the fact that you're able to like raise money to help a child, it feels like me getting help for my own child. So kind of gives us a fulfillment. Yeah.
that's nice.
Thank you.
Honestly, you're doing so well.
Thank you.
Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. Phatex Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Wendy, how long have the foundation been in existence?
I would give it a year. We started like 3 years ago, but as I told you, it was just a nurse helping her patients using social media.
Okay.
But the foundation registered legally everything 1 year.
So you started 2019.
Yeah,
Okay.
yeah, a year. I think a year. But the whole support thing started in 2017.
When you were using the social media
Yeah.
to generate funds.
We still use social media though.
All right.
It's basically social media.
What's the name of your foundation on social
Jimmy
media?
Hans Foundation. But actually, I use my name a lot because people are comfortable supporting Wendy rather. Like, okay, I want my money to go to the number registered to her, so I know it will be used for the
Okay.
intended purpose. So most of the time, I use my personal page. It's normal my personal page because I barely post anything personal anymore. And then we use the foundation page.
Oh, okay.
Yeah.
Wendy, what do you think the Ministry of Health can do to help nurses like you who are trying to do their best?
Honestly, I don't really expect any personal help for me, but I was hoping they could like help out. Like when it comes to these needy children that are sick, those that cannot afford the same quality healthcare that those in quotes that have money can afford, I would wish they would do more for such children so that the plight of their parents having to go to the hospital back and forth, eventually some of them lose these children and then you go into it and you realize that it's because of money. So probably I would rather wish they could put measures in place to support these children and just I don't want any recognition at all.
And I hope they would really hear this because it's sad to go to the hospital, lose a child because of lack of
Yeah.
funds.
Funds, basically. That's our
Yeah.
biggest challenge. Yeah, funds.
What's your vision for the foundation? What is your vision?
I mean, this whole thing, we have a vision of spreading health, quality health care to these needy children. And then we would also want to support the needy mothers, their needy mothers. Because once you empower them, basically their kids will be okay. But if they have something doing, I mean, they don't have to stress themselves of like who would support me, where should I find support. The nurse will not have to go through the ordeal of calling you, can you find support for us and stuff like that.
Yeah.
Yeah. So basically, we want healthcare, especially our concentration is on the needy child,
Okay.
those that need people to stand in for them. Yeah. And then also help empower these somehow teenage mothers. Yeah.
It's very, very important.
Yeah.
Very, very
Yeah,
important.
exactly.
Do you have any advice for health workers? I know you, I mean, I've met you and you're an angel, let me tell you. You're a nurse who an angel, who is an
I'm
angel.
human. Thank you,
But
by the way.
then I know there are nurses out there who can be cruel sometimes. It's not, I wouldn't say heartless, but they can be cruel and harsh to their patients. What advice will you give to health workers who sometimes forget that being a nurse is actually a ministry?
Hmm. That's a tough question, by the way. Anyway, sometimes when you look back, it has a whole lot of settings to it. Because one, the nurse patient's ratio is outrageous. Some of these, in quotes, nurses get frustrated by the amount of work they have to do, and they are human. It's not everybody that can contain that kind of stress. But this whole thing, the nurse was rude, the nurse was mean, should start from when you have the intention of going to nursing school.
Yeah.
Have that idea that, okay, what I'm venturing into, whichever patient comes my way, envision that this patient is my mother, this patient is my dad. So whatever I'm doing to you, someone will do to my family. Exactly. And then sometimes put your shoes in the, like in their shoes as well. Walk a
Empathize
mile in
with
their shoes.
them.
Probably you give them a pat on the back. So you realize that you need to know what nursing is about. You need to be a person that can be selfless. Don't just walk into nursing because, oh, I'm assured of a job, or at least I get a monthly salary. No, but have the passion for it. Be born for nursing before you enter into it. Don't just go it because it's a job opportunity. And then mostly some parents also push their children into it because, oh, you are secure, like your job is secured. But
Yeah.
maybe they should give the kids the opportunity to choose for themselves.
For
Basically,
themselves.
that's where everything should start from. If you really want to curb this rudeness, meanness, then it has to start from having the idea of entering nursing school. Yeah.
I think you've said it well because, as example, the patient's part, the parents' part. You know,
Yeah.
sometimes you get parents that they are making their work do
Yeah.
probably professions that they wish they would do, and
Yeah.
it's not something that it's something that the
Yeah.
child doesn't want to do it at all.
Yeah.
So,
Yeah.
thank you for really raising those
Yeah.
important
Yeah.
points. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suit your taste, giving you a chance to be you. Phatex Ultra Sanitary Pad. It's organic, super absorbent, and safe for every lady to use. A very big thank you to Star Bites, the airport branch. Guys, it's a lovely place. Come meet, eat, and drink. Well, viewers, we've come to the end of today's episode. It's been interactive and informative. Please, nurses, we have angels like Wendy who are doing their best to be more than nurses. You can do your best. Don't just go for the nursing form because you are assured of a job. Please, make sure you have the passion. The world needs altruistic nurses and health workers now. So please, make sure you want the job. Thank you, viewers. Enjoy the rest of your day. Stay safe and see you soon. Bye.